So I'm really excited to be here. I love talking about mental health. I love talking about depression, and really how can we as providers continue to do better and think outside the box and keep, moving the field of mental health forward. And I think it's a good question to ask because of many classes of medications, psychiatric medications have one of the most poor response rates. And in fact, if you really look at psychiatric medications, the response rate is only about 30%. And these studies were done in SSRIs and SNRIs. Okay, so many papers that have looked at what diet does to mental health, and again, preaching to the choir here in terms of what plants in our diets and polyphenols and how important they are. But of course, the research says the same, and so I think that this is a good entry point in terms of being able to really focus on that, and that just like exercise, diet is just as potent. Okay, so one of them is called the mu rhythm. And the mu rhythm is a characteristic in the brain that makes social connection more challenging. And so these individuals tend to have a little bit difficult time picking up social cues, body language, connecting with people when in conversation. Another pattern, let's see how we're doing on time. Another pattern that we see is the TBI pattern, traumatic brain injury pattern. Traumatic brain injuries basically present with overwhelming slowing of the brain. So this is what we call excess posterior delta. And delta waves are like your slowest brain waves, right? So these are kind of the waves that are present in sleep and just before you go to sleep. So how can we screen people to say, are they this subtype? I mean, the most basic thing we can do is running a CRP or a high sensitivity CRP on all of our depression patients. Because most of the studies are looking at CRP as the inflammatory marker. And so running that. And they looked at studies that compared response rate to different antidepressants. So kind of in summary for part one here, right, is that we know depression is not a homogeneous disorder. And that if we don't get more specific with what we're treating and how we're treating it and what depression is for an individual, I think we're missing the boat.